most people are just fixated on glycemic index. I recently had a gentleman come to the office, and I was explaining to him because he has kidney disease. He's diabetic. I was pretty much trying to let him understand that he needs to watch his carb intake, and he started lecturing me on glycemic index and this and this and that. But I'm saying to myself, if you knew all of this, why are you in this state of kidney failure? Because if you are diagnosed with kidney disease or chronic kidney disease, it means that you didn't do something right. Most people just fixated on the fact that once they start getting the comorbidities that comes with diabetes, they assume that because they have diabetes, they are therefore supposed to have those conditions. And this is not true. It's absolutely false. It's just a fallacy. And I'm here to just try to let us understand why glycemic index may be killing a lot of us, especially for those who are type 2 diabetics, for those who are type 1 diabetics, for those who are metabolically compromised. So what is glycemic index? When we say glycemic index, simply is how fast carbohydrates turns into sugar. There is a scale. Anything greater than 70 is considered high glycemic foods. Between 56 and 70 is considered medium. And anything less than 56 is considered low glycemic index, and most diabetics jump on that bandwagon and just eat their way through these low glycemic foods, yet their blood glucose is elevated, their A1C is elevated, and they don't know why that is causing that. And I'm here to explain the reason why that comes about. There is really a big flaw, or there's this thing about glycemic index or shortcomings with this glycemic index. One, when we talk about glycemic index, it's pretty much saying that this food can spike your blood glucose. So it's a food's propensity to elevate your glucose. What it doesn't do is it does not factor the amount of food that will do that. That is one. That's one of the shortcomings of the glycemic index. Two, most of the time, we don't eat food in isolation because, for example, if you're going to eat, say, watermelon, it's usually at a barbecue. You have enjoyed the protein, all the fats that comes with the barbecue, and of course, you enjoy some watermelon. If you are doing that, you're not going to get glucose response as you would if you had eaten the watermelon in isolation. So that is another shortcomings with that. And the third thing about glycemic index is that everybody is different. And for that reason, everybody responds to the eating of these foods differently. For example, you can have a cup or a bowl of ribs. Your 10-year-old or your 15-year-old daughter or son will eat it. You check his sugar before, and 1 hour later, you check and he is in a normal range. You, on the other hand, will do the same thing, same size and everything, and 1 hour later, you realize that your glucose is way off the chart or way off the roof. So what does that mean? It means that we have individual responses to glucose. So the fact that a food has a propensity to increase insulin or increase glucose does not mean that the same thing is going to happen from person 1 to person 2 to person 3. So these are the three shortcomings of the glycemic index. And I know most clinicians, most people sit on TV and on radio and say the glycemic index is low, and for that matter, we have to do low glycemic foods. And that's just a wrong assumption. I'm sorry. If you are doing that, then we are really not appreciating the science that comes with this stuff. There is this thing called the glycemic load, which is pretty much a concentration of carbohydrate in the food. So that factors the glycemic index. As far as formula goes, is the glycemic index times the number of carbohydrates in there divided by 100, and that gives you the glycemic load. With the glycemic load, anything greater than 20, it means that it's too high. Between 10 and 20 is medium, less than 10 is okay. And the assumption with that too is that in a day, in a 24-hour period, you shouldn't go beyond 120. The number 120 for the day for the glycemic load. It is actually better in terms of comparing with the glycemic index simply because it addresses one of the flaws of the glycemic index, which is it factors the carbohydrates. It doesn't factor the other two, which is our individual responses, and also foods are not really eaten in isolation. And I'm going to use two examples here. If you look at watermelon, for example, the glycemic index of watermelon is really high, but the serving size of watermelon is really a wedge. Dr. Google will tell you that, a wedge or maybe a cupful. And this is what a cup is. When we talk about cup, this is what a cup is. And a cup of watermelon is about 12 grams of carbohydrate. So if you're really doing the serving size, you can really get away with that. But we have been told that it has high glycemic index and most people are staying away from it. The other thing is that if you are doing the serving size and you are doing that with something else, fat or a protein, chances are your response may be quite different than eating just this 12 gram of watermelon in isolation. So that's also another thing that needs to be factored. The third thing that needs to also be factored that if you are eating the watermelon and you are insulin sensitive and you are just doing this size, an hour after you have eaten the watermelon, chances are your blood glucose will be lower. Whereas somebody who is insulin resistant or type 2 diabetic or type 1 diabetic or just metabolically compromised, it will have a profound impact on your blood sugar. So for most of us, the low glycemic foods are what is actually killing us. If you take plantain, for example, on the glycemic scale, on ripe plantain is about 39. So I'm sure you're going to run with that because it's low on the glycemic index. However, the carbs, the amount of carbs in that is really high. And that is why, despite plantain being told to us that it's low on the glycemic index, it's spiking a lot of glucose in a lot of people. So these are some of the things that we have to keep in mind, appreciate, and understand. So if you are type 2 diabetic listening to me, the low glycemic foods may be the reason why you have the cataract. The low glycemic foods may be the reason why you have kidney failure. The low glycemic foods may be the reason why you are not doing as well as far as your A1C is concerned. It's because you have been told that the glycemic index is low. You are not factoring how much you are eating. You are eating it in isolation. And you have forgotten that you are insulin resistant. And for that reason, what Ama or Kweku will do and get away with it, you cannot. And that is what you have to keep in mind. In my office, the amount of carbohydrate is what we speak. And that's what we try to drive into most of our patients' head because it's very important. It makes a lot of difference in terms of their impact on blood glucose. How do you determine the carbohydrate content in foods? The same way Dr. Google told you that plantain is 39, you can also check for your other foods. And as you start appreciating that, you start learning to know the foods that you ought to stay away from, especially if you are insulin resistant. The goal for anybody, type 2 diabetic, metabolically compromised, is you want to stay under 50 grams of carbs. If you are able to do that, you start improving your metabolic health, and that is very, very important. How do we do that? Lower the amount of carbs that you ingest. If you go by the status quo, which is the recommendation by the American Diabetes Association, you are going to kill yourself because the American Diabetes Association recommends that we eat over 300 grams of carbohydrate a day. How do you determine the carbohydrate content of whole foods like plantain? If you take the medium-sized plantain, it's about 57 grams of carbohydrates. The fiber is only minimum 4 grams. So if you deduct, you have 53 grams of net carbs. And that's what we need to pay attention to. If you have 53 grams of carbs, just to make the math easy, if you make it 50 grams and you divide that by 5, you have 10 teaspoons of sugar. And that is why plantain is able to spike your blood glucose. Just one medium-sized plantain. But you have been told the glycemic index is 39. And you are wondering why you have the cataract. You are wondering why you have the neuropathy. You are killing yourself with the low glycemic foods. Watermelon, on the other hand, if you're doing the serving size, if you're factoring the serving size, even though it's high on the glycemic index, the carb is low. And for that reason, it's not going to spike your blood sugar as much, especially when you don't do it in isolation. And also you stick with the serving size. How do you determine that? Let your blood glucometer be your judge. If you are testing, you know what I'm talking about. If you are not testing, just take it as I'm telling you because of the symptoms you are experiencing. If you start doing that, you'll be in the right direction in fixing or reversing or putting your type 2 diabetes or insulin resistance into remission. It's doable. You can do it. We have been doing that in our office for years. If you want us to help you, we are always a phone call away. You can reach us. What we do in our practice is we get to the root of the issue. We have a conventional pharmacy and we have the functional medicine clinic where we focus on getting to the root of your problem. My name again is Dr. E. And if you haven't subscribed, please do like, share, follow, and subscribe. Until another episode,